Now, the most affected area of the brain in people with OCD would be the basal ganglia. Basal ganglia is a group of subcortical nuclei of varied origin which are situated at the base of the forebrain. Basal ganglia are strongly interconnected with the cerebral cortex, thalamus, and brainstem. Now, the two brain structures that communicate with the basal ganglia are more active in patients with OCD. These two structures are the orbitofrontal cortex, OFC, and the anterior cingulate gyrus, which stands for ACG. It is necessary to know that these structures act to detect errors in brain circuits, and the interactions with the basal ganglia explain how OCD manifests. Scientists have postulated two theories how OFC and ACG affect the basal ganglia in patients with OCD. The first theory is damage to ACG and OFC. This resulted in loss of error detection abilities, which caused the brain to increase repetition of messages, and thus the OCD begins. As a result, patients tend to be confused and in need to repeat whatever he's doing, which results in compulsion. Now, the next theory we are going to discuss is the overstimulation of ACG and OFC. If these two structures are stimulated beyond normal range, they cannot accurately detect errors and may fire at inappropriate times, and thus OFC and ACG would send excessive, erroneous messages to the basal ganglia that there is a problem. This is exactly what patient reports: a sense of dread, intractable feeling that something is wrong. When the brain is in this repetitive hyperexcited state, it is in a state of brain lock. Brain lock refers to the four areas of the brain that are overstimulated in OCD patients, and thus these four structures are locked together as one in patients with OCD. To release the patient from brain lock, physicians typically prescribe medications or cognitive behavior therapy. That is all for me. Thank you very much. Hope you enjoyed the video.